This is Anatomage Table, and this is a 3D virtual anatomy table on a virtual platform. So what happens here is we have the whole anatomy body over here of the person, and it's a three-dimensional view that we can see him in all the ways, all the views over here as such. Okay, and this person can be zoomed up, so you can see your point of interest, which body part of body you are, of whatever interest you have, and then you can zoom up and then dissect the person and then see him in different layers of the body over here as such. Okay, and he has a high resolution anatomy also. You have multiple high resolution images over here. There might be about 40 of them, and then the body as such, there are gross anatomy bodies of 5 different bodies over here as such for the learning purpose. In addition to that, you have a histology aspect over here where you can see the tissues of the body as such. So which part of the body, suppose it's the bone that I have to see, I can see the bone tissue over here, which is visualized over here in this histology aspect. The ligament over here is seen in this, the dense connective tissue. Then maybe the lungs, the liver aspect, and then the lungs over here. So these are the synonym of what is seen over here. The histology part is seen in this aspect as such. In addition to that, this person can be sliced into half, and the structures can be cut open and seen this way, and that can be zoomed up and as well as got down, and then it can be sliced in the sagittal way also, and this can be zoomed up and zoomed down to see different structures and in different ways as such. In addition to that, you can visualize the whole structure by taking the body part out and seeing the structure behind it, and you can undo it. And also, suppose if there's one body of interest, you can just highlight that body and the whole other part gets faded out. So this can be of your point of interest as such. So these are the things that can be done in this. In addition, for the students, you have the preclinical students who come and learn the anatomy aspect over here, and the advantage with this is you don't have the smell of a formalin over here because it's not being a cadaver, and you can redo things over here multiple times. You can redo that stuff multiple times, so that there's undoing and redoing stuff in this. And you can have a quiz aspect, you can draw things on this, and also your point of interest can be focused on this while you're educating the students. You can erase this structure off, and then you can also type in text over here for the understanding students. You can have a minimal quiz in the students and then ask for what structure is this and label them off, and that can be done. And for our these are the undergraduate students that we teach them, and this thing can be integrated for horizontal integration with other aspect of the structures like heart sounds. I'm showing the heart anatomy over here and then displaying the heart sounds in the high fidelity mannequin as such. And then using the DICOM files, which I usually use for our postgraduate students, we can teach them how the pathology is. Or suppose you have a posterior dislocation of humerus, and in that we have injury to the proximal aspect, head of the humerus, with the structures damaged over there. So we load this DICOM file into this, and we can display the normal anatomy on one side and keep the pathological stuff on the other side, and compare them, and then should show them to the students to understand the pathology better. So that way this can be used for our postgraduate students also. And sometimes for onco related stuff also it can be used, where we use the onco DICOM files from the radiology and load them into the system and then use this. This whole system is on a Windows operating software, and it has a hard disk of beyond 500 GB and very high resolution graphics card, as well as a very strong CPU. So this is about it for the Anatomage as such. Thank you. So in this we have the heart as such. Suppose this is a point of interest for us where we have to display and show over here. This can be zoomed and then just shown over here, and this will just go all the through into the tissue and go through the structures in one plane, and then that's how the student will come to know the different aspect of the structures surrounding it. This is a zoom version. This can be unzoomed also. This is the blood flowing through the inferior vena cava, auricles, ventricles, and then going to the pulmonary artery and then to the lungs. So, and the other structure is the video of playing from the lungs coming into the left auricle and to the ventricle, and then ending up going to the aorta.